Last week, a 9-year-old girl in Nakaseke district died of what was initially suspected to be Crimean Congo fever. The Ministry of Health later established that tests had shown it was not the hemorrhagic fever.
There is no cause for alarm. Uganda, we have developed very strong mechanisms to deal with any epidemic.
Varying views on the existence of the disease soon turned into a ping-pong of accusations, counter-accusations and denials between the district's local authorities and the Ministry of Health, which gave assurance that there's no cause for alarm. Now, the Medical Association says health workers are at risk.
We believe that the best way to respond to an epidemic is to get its reservoir, educate the communities, and mainly protect the health worker. And I must emphasize this, that this is a very highly contagious disease, and the health workers must be protected.
I also want to encourage the health workers that please do not touch any patient without protective gear. The Ministry of Health, through national medical stores, continuously gives these medical supplies to the health facilities, and please ensure that you use them to also protect yourselves against these diseases.
Dr. Mkunzi Mhereza is Uganda Medical Association's General Secretary.
We therefore want to state our disappointment in the way the epidemic has been handled by the Ministry of Health, especially the technical head being the permanent secretary, and this was very unprofessional.
The doctor says they are not satisfied with the Ministry of Health's handling of the disease.
We therefore state that one confirmed case of Crimean Congo Hemorrhagic fever is an epidemic already. It should activate emergency level.
We are surprised as a ministry that the Uganda Medical Association leadership could go and address the media regarding the issue of the Crimean Congo Hemorrhagic fever. We have the Uganda Virus Research Institute, which has state-of-the-art laboratory that actually tests for whatever hemorrhagic fevers and other diseases that we have in the country. So it is not true that the Ministry of Health, as alleged, is trying to conceal an outbreak.
On Sunday, Health State Minister Sarah Opendi confirmed that one of the blood samples from a 9-year-old boy had tested positive for the fever, adding that he was recuperating well.
So, Uganda Medical Association, you are aware of the systems within the Ministry of Health, and we want to appeal to you to work closely with us. Work closely with the National Task Force, rather than going to alarm the population that there are cases in the community, whereas they are not there. Congo hemorrhagic fever really comes from the ticks. Once the ticks are infected with this fever, they definitely pass it on to the cattle, and of course the human beings may get it from the cattle.
Mkunzi says the ministry has not done enough to sensitize Ugandans about this disease. Shiran Hochre, NTV.